Hi there, it's Justin Lubino with Senior Advisors. And if you're watching this video, it's probably either because you submitted your prescription information to us to do a Part D analysis for you, and you're just curious about how we do the Part D analysis, or maybe you'd like to do the Part D analysis on your own, and you can watch this video to help you understand the process as far as how we review the best Part D plan for each individual. There are about 20 to 25 different Part D plans available in each state, and it's really important to check based upon your specific list of medications as far as which of the Part D plans would be most cost effective for your situation. I created a video similar to this a few years ago, and this is just an update based upon some minor changes that were made on the Medicare website this is now July of 2018. So for 2019 annual enrollment, this is the tool we'll be using and the process to determine what is the best Part D plan for each individual. So the first thing we do is we go to Medicare's website, which is Medicare.gov, and we click Find Health and Drug Plans. You can also find the same option underneath the Part D coverage menu here. Either one of those will work and take you to the Medicare Plan Finder. And then we're going to enter in the zip code, Cranford zip code, which is where our office is here. And we select Original Medicare, enter information, how do you get your Medicare coverage, do you get any additional help? We're going to say we don't get any extra help right now for the case of this example. And yes, I would like to add drugs right now, and continue to plan results. On the second screen is where we actually get to enter our drug information, okay? So for the example, if you watch the prior video of filling out our online RX form, there were only 2 drugs that were entered, and we're going to continue with that same example. One of the drugs was atorvastatin, which is a generic for Lipitor for cholesterol, and it was entered at 40 milligrams once per day, so that's 30 per month. And we're going to hit Add Drug and Dosage to add that to the list. And the other medication that was entered on the form was valsartan. So valsartan for 320 milligrams, also once per day, add drug and dosage. So now we've updated our list. Again, this example, the individual's on only 2 medications. We've added those both to our list. If we need to change the dosage or remove the drug or add a drug, we can do that here. Another interesting thing that we'd like to do is to save this drug list ID and password date with the zip code. These 3 identifiers, if you save them and you go back in at a later point, you'll be able to retrieve the drug list that you entered, so you don't have to re-enter the drug information. That's very important when you have a longer drug list. It saves you a lot of time, so you have a starting point to work from. So we recommend saving that information if you're doing this on your own. Okay, so we've entered in our drug list information. We click My Drug List is Complete. On the next screen, it's going to ask us to step 3, which is select your pharmacy. You can select up to 2 pharmacies. And in this example, CVS and Walgreens were the 2 that the individual entered on our prescription form. And we don't see a CVS here because they're only looking a half a mile away, and there isn't a CVS a half a mile away. So we can increase that up to 3.5 miles, and I'm sure we'll find a CVS in here. Here we go. We can select really, yeah, whichever location is important to that individual, but the pricing is going to be similar, if not the same, at a large chain like a CVS in this area. And then Walgreens was the other pharmacy, so we're going to add a Walgreens as well. So we've now added the 2 pharmacies that were entered on the prescription form on our website, CVS and Walgreens, and we click Continue to Plan Results. On step 4, we're going to select prescription drug plans with Original Medicare. These are the standalone Part D plans. If we were looking for a Medicare Advantage plan, you would find that information in these second and third check boxes. But the purpose of this video is looking at Part D analysis, and you see there's 22 different plans available right now for Part D in this state. We click Continue to Plan Results, and the next screen here is going to be the results. So all 22 of those Part D plans, I'm going to select View All so we can see them all. They're all going to show up here in this list under Prescription Drug Plans. and they're going to be sorted based upon the total overall expense for the rest of the year. That's the premium plus the cost of the drugs, and the least expensive plan is going to be at the top of the list. And it's based upon the cost of the drugs at the pharmacy. Okay, so there could be a lower cost mail order option, but for this example, it's sorted, and actually anytime you do this, it's going to be automatically sorted based upon lowest remainder of the year costs. That's premium plus the cost of the drugs. So if we're just looking at this total cost, it's $114 for this Aetna RX Select. That includes the $19.70 per month premium. It includes the fact that there's a $405 deductible. So clearly these drugs do not apply to that deductible. But if you get a higher tier brand name drug, with this plan, you'd have to pay that $405 before the coverage kicked in. But this is really the key value. Based upon those two drugs we entered for the next, we're running this in July, so August, September, October, November, December, for those 6 months or 5 months, the total cost between the premium and the drugs is $114. If we go to the next plan, Express Scripts Saver, you'll see the total cost is $164. This is going to continue to increase as we go down the list. This plan has a higher premium. It still has a $405 deductible, and the cost of everything, the premium plus the drugs for the rest of the year, is $164. This does have a mail order program, which would be a little bit cheaper, $152, but that's still more than the $114 that this Aetna plan would be. By the way, this Aetna plan does not have a mail order program, so that's something else to be aware of. If we keep scrolling down, the next one is this AARP Walgreens, which is $164 also. It has a higher premium, still has a $405 deductible. Humana Walmart is $181, $20 premium, $405 deductible. So if you continue to scroll down, and you'll see the numbers continue to increase. If we go all the way to the bottom of the list, in this example, the most expensive plan would be $543 the rest of the year for this Horizon Enhanced. And the reason is the premium's $100 a month. So it's not that the drugs necessarily are expensive, it's that you're paying $100 a month in premium for 5 months. That's your $500 right there. So we generally don't recommend over-insuring, or overpaying, I should say, for the Part D drug coverage. And the reason is just because you're paying $100 a month doesn't necessarily mean that it's a better formulary. It's really going to be specific to the medications that you're currently taking as far as what the cost is going to be and what the most cost-effective plan is. Additionally, you have one opportunity every year to review your Part D drug plan between October 15th and December 7th, and we recommend you taking advantage of that opportunity every year to make sure you have the right prescription drug plan for the following year. Because even if your drug list does not change, these Part D plans change every year. Part D of Medicare changes every year, you want to make sure that your drug is still covered on the plan that you select, and you pick the most cost-effective option. So I want to show you one other thing, just a little more detail. If you actually click on the plan name, this is the plan that we would probably recommend in this case because it's the lowest cost. If you click on the plan name, you'll get a lot more detail for this specific situation. First of all, you're going to get, again, the premiums $1970, deductible $405. This shows you estimate of what you're going to pay at the pharmacy. So this is important. We looked at CVS and Walgreens. This is a preferred plan at CVS, but not at Walgreens. So if you get this plan, that's something else important to understand. You cannot use it at Walgreens. It's going to cost you an arm and a leg for those very inexpensive medications if you try to use this plan there. So CVS would be preferred with this particular Part D plan. And you can see, again, this is the breakdown of costs at Walgreens, which is ridiculous. Because these costs, the full cost of these drugs is without insurance is much cheaper than these numbers you see here. But this is because it's out of network. Bottom line is you wouldn't use it at Walgreens. At CVS, however, you could see $3.27 is the full cost of these drugs. It's a zero cost during the deductible. So this Lipitor generic actually has a zero copay. There's no cost even during the deductible phase for this medication at CVS. The blood pressure medicine generic is $3 during the deductible, and it's the same if you happen to reach the deductible, you're still paying $3 a month for that particular medication. So pretty straightforward example. These are inexpensive drugs for this individual. This just shows you by month the $23, which is the $1970 in premium, plus the $3 for the drugs. your directional cost per month is about $23. This chart will look a lot different if you have very expensive medications. You could see some increases and some, based upon the donut hole. If you reach the donut hole, and then catastrophic might drop down again. But for this example, it's pretty straightforward, pretty flat premium plus the drugs for those 5 months. And there's some more information here about the drug tiers and information in this list as well. But generally speaking, that's how we pick the Part D plan for each individual. And if you want to do this on your own and do the analysis, you can certainly do that using Medicare.gov. I hope this video is helpful for you to understand how to do that. If you'd like us to do the Part D analysis, we could certainly do that for you. We have a prescription form on our website, which is at senior-advisors.com, senior-advisors.com, underneath products and Medicare Part D prescription. You would click free RX analysis, and you can go down and fill out our online prescription form with some general information about your drugs. And you submit it online, and you'll get an automatic email response from us letting you know that we received it, and we're working it for the Part D analysis. We have another video you can watch on how to use this form for your online RX entry if you preferred for us to do the Part D analysis for you. All right, if you have any questions, you can call us at one of the numbers you see above at any time, and we can certainly help you with your Part D planning or Medicare supplements. We are contracted with all the top insurance companies that are out there for the Medicare supplements as well, and we can certainly recommend what the most cost-effective option will be for you in your particular area. All right, we hope you have a great week. Thanks a lot.